things that hit home for a patient is pain after surgery, okay? What I will be able to do after surgery, the blood loss during surgery, the time, how long it takes of the surgery, and the biggest is whether I can go home the same day or how long will I stay in the hospital. I really feel that those descriptions explain to a patient how the surgery really will be, instead of just labeling it MIS or less invasive surgery. So I think those are really the key factors. And so if you can do a surgery, whether it's a posterior fusion, whether it's an XLIF, whether it's a decompression, whether it's a cervical fusion, whether it's a cervical disc replacement, but you're going to do it in an ambulatory center where the patient is going to go into an office-like an environment, get taken care of, you know, it's probably great customer service, and go home the same day. And what dictates the patient going home the same day is how much pain the patient's going to be in afterwards. So if you can do procedures and make them less invasive, that cause less pain, and you're able to do them in an outpatient center, then that tells the patient more than anything that this is a less invasive surgery, because I'm going to be able to go home the same day. I'm not going to be in so much pain that I'm going to have to be at a hospital. Patients are now very cautious of you know, opiate medications. And, you know, I think that is where you have the tremendous benefit.
Yeah, I think, so talking to patients about less invasive surgeries, I think there's enough marketing out there and enough noise about these less invasive surgeries. There was you know, the big, huge marketing machine of the Laser Spine Institute years ago really turned people on to this concept of minimally invasive surgery and how can we get it done same day kind of thing. And so I think being comfortable with these techniques, these minimally invasive techniques, patients are going to ask for it, especially the educated patients, patients that have read. They're going to ask, can you do a minimally invasive procedure? And to be able to say, yes, I can. And this is how we're going to do it. And this is why I think it's better for you. I think that wins a lot of confidence for those patients. I think in regard to telemedicine, there are some challenges in that we don't have the ability to touch the patient. We don't have the ability to lay hands on, but we still, if telemedicine is used efficiently, and through this COVID, we've had the opportunity to do this extensively since, for the last 5 months, we've been 4 months, we've been, it's now become part of the routine for us. We can establish relationships with people that we can't actually have in the office, so that when we do see them, they already know us and we know them, and we can do what we need to do from a physical exam standpoint, but we've already established a fairly effective relationship. So I think for those patients that either pre-op can't make it in for whatever reason, or even post-op, if they have questions and they want to reach out to us, this is a great medium for continuing that relationship between the surgeon and the patient. In terms of resources for the patients, being able to provide patients direction, I think the Better Way Back is fantastic. We've been using that for years to help patients get information. There's a few other websites that are also effective, but I think being able to provide patients with not only information directly, but effective resources, and NuVasive has a lot of those resources for us as surgeons, but also for patients. Having that information available and being able to provide that to patients, I think is a valuable skill, or it's a valuable tool to be able to provide to them.
Nowadays, I would say there is a lot of resources on the web that can be very useful for patients. Also, we have the different societies, that are entities, because what you don't want is to end up in a marketing tool kind of website where they may misdirect the patients. You want organizations that actually are as much as possible unbiased with legitimate scientific information. So that's why, for example, it's good to visit a society like a Society of Minimal Invasive Spine. It's called SMIS. Also the AANS, American Association of Neurosurgeons, the Spine Joint Section, which is also a really good organization, the Scoliosis Research Society. They're all of them good sources on the web that can give really good information to patients in an unbiased way, because they are out of the commercial interest. They're more on the academic and more on the educational part of the patients. So there is a lot of resources, and I think nowadays it's easier. So I recommend you strongly that before you have the surgery, look on these places what is available, because always you want to know what are all your opportunities.
So in the midst of the viral pandemic, telemedicine has thankfully become very prevalent and the norm. I'm currently still seeing patients 90% via telemedicine. It's not unusual for me to do a whole day of clinic and not actually have one person in my office in front of me. We can do all of this by video or phone or both. The hope is that they will continue to allow this. It has been a huge benefit in terms of convenience for patients and patient satisfaction. One thing for sure is that no one is ever upset with me for being a little bit late to see them for their appointment if they're sitting in their kitchen. People have to drive all the way down to my office and sit in the waiting room for a while, and then sit in the exam room for a while, and then I walk in and I'm an hour after the appointment time. They're automatically a little disgusted with me, and rightfully so. And nobody has that kind of response when the appointment is happening in their living room or their kitchen on their laptop. So I hope that it's here to stay, honestly, if for nothing else, for that reason. The other thing that's true is in my practice, I see people from a great distance every day that I'm in the office. There's not a day that goes by in my clinic that someone isn't seeing me from 3 and 4 hours away, and sometimes farther. I saw a patient yesterday. I'm here in the Dallas market, and they came from Omaha, Nebraska. Well, he actually did travel to come and see me in person because he had a pretty complicated scenario, and I was like his fifth opinion. But he won't have to come back again as long as I can do telemedicine with him, and that is a major advantage. When you operate on somebody that lives in another state, there's always that awkward problem of how do I really provide good follow-up and monitoring of this patient after the surgery. I may do some great operation and all that, but part of taking care of them is monitoring their incision, talking to them, finding out how they're doing. It's so much nicer to tell them, you don't ever have to come back here unless you have a problem. I may request that you present to me in person if there's an issue that I need to lay eyes on or put my hands on. But honestly, if everything goes well, I can see you 12 times and you never have to leave your house. I think in general, I try to relate to people that honestly, surgeons almost universally are really trying to be as less invasive as possible all the time. It's true that there are certain techniques that are coming along that are becoming more in vogue that are clearly less invasive, and not everybody has that experience, training, or skill set to execute those procedures, or they may simply not be interested, or they may have just never been exposed to it, so it's just not part of their practice. And that doesn't mean that they're not making every effort to be as least invasive as they possibly can to execute whatever goals they have for the surgery. I alluded earlier to the mindset is really to keep all of the potential techniques that apply to a particular diagnosis in mind and really figure out what works best for this patient under their circumstances, taking into account all the details, their age, their medical comorbidities, their anatomy, et cetera, to figure out which approach is the best way. But the goals of the surgeries should remain the same, whether you do it through a little incision or a big incision. And if you're compromising on the goals, then you're probably not thinking about it right. You should be trying to accomplish decompression when decompression is necessary. Whether that's direct or indirect is a judgment call. And which interbody procedure, if any, is indicated is also going to be different from patient to patient. And in some situations, you may have several choices, in which case you're going to choose your favorite operation, or when all else fails, maybe the least invasive operation, the one that happens the quickest. And then maybe somewhere on the list is your concern about cost and expense. You may, in your hospital system, find that one particular approach is just simply more expensive and it's not better than another. So you tend to steer clear of that unless you had some other factor pushing you in that direction.